Hello everybody, welcome to this behaviour change webinar series. Today we will hear part 2 of 3. So part 1 has already happened. It's available for watching on the SuSanA platform, and but don't worry, Om will give us a little introduction. So this series is intended to be a guided and thorough introduction to behaviour change, with a focus on how to assess, design, implement and evaluate an important behaviour change approach. My name is Connie Benjamin. I'm based in WaterAid UK. I work supporting the development of SuSanA as part of a Gates Foundation grant. I'll be introducing today's webinar and presenters and facilitating discussion later. This webinar series launches SuSanA's newest working group on behaviour change, Working Group 13. Working Group 13 aims at fostering learning about behaviour change amongst SuSanA members, promoting collaboration and synergies amongst those working in behaviour change, and raising the profile of the importance of addressing behaviour change in relation to sanitation goals. I encourage you all to join Working Group 13 if you are not already members. This webinar series is hosted by SuSanA and Stockholm Environment Institute and is supported by Gates Foundation grant. WaterAid and London School of Hygiene and Tropical Medicine are also supporting. Just a quick note to say this webinar will be recorded and uploaded to the SuSanA website. It will also be stored on YouTube, so you're aware. Our presenters today are Prasad Gautam, a public health expert and behaviour change scientist with more than 17 years of work and research experience in water, sanitation and hygiene, environmental health, behaviour change, child health, immunisation, food hygiene and safety, and disease surveillance programs. Holds a PhD from London School of Hygiene and Tropical Medicine, 2 master's degrees, one in public health and another in social sciences. Currently works at WaterAid as Senior Wash Manager for Hygiene, based in London, UK. Is also one of the leads on SuSanA Behaviour Change Working Group 13 and has previously worked at various international organisations, including World Health Organization. And then we're also joined by Bob Aunger, Associate Professor in Evolutionary Public Health at the London School of Hygiene and Tropical Medicine. He has a Master's in Urban Planning from the University of Southern California and a PhD in Biological Anthropology from the University of California. He did postdoctoral work in psychology at the University of Chicago and King's College, Cambridge. He has also taught at all of these institutions. He's the lead developer of a novel approach to behaviour change called behaviour-centred design, which has its origins in evolutionary biology, ecological psychology and commercial marketing. For over a decade, he has helped implement research and large-scale public health projects in water, sanitation, hygiene, nutrition and HIV, using this approach in multiple countries on the African and Asian continents, including designing creative materials for mass media and community activation. So we're very pleased to welcome you two presenters now. The webinar today will last approximately 80 minutes with time for questions. You can ask questions as we go along in the chat box and we'll put them to the presenters later. You can also press the raise hand button at the top of your screen, and after the presentations we will unmute your microphone and you can ask questions directly. I will now hand over to our presenters who will explain more about today's agenda. Thank you.
Thank you, Connie. Hello everyone. Good afternoon, good evening, wherever you are. First of all, on behalf of SuSanA Behaviour Change Working Group 13, WaterAid and London School of Hygiene and Tropical Medicine, I would like to welcome you all on this webinar series, which is the second series. As Connie mentioned earlier, so we have already conducted the first series in March. So on that particular series, we have covered different aspects of behaviour change, which includes theory behind behaviour change, what works, what doesn't in behaviour change arena when it comes to program design and implementation. And we have also introduced different theoretical model in the first presentation. So basically when you design the intervention, of course, there is a tendency to design many interventions based on what experts think rather than what theory tells. At the same time, designing based on the expert opinion rather than more programmatic and evidence-based learning. So we really want to sort of communicate those insights through these webinar series. Therefore, our first attempt and focus in our previous learning series was to introduce different theoretical model underpinning factors that actually lead for sustained behavior change over time. If you have missed our previous webinar series, please you can download recordings from the SuSanA working group website and you can listen to them. So before we actually start today's session, first of all, I would like to bring everyone up to the same speed. In order to do so, I would like to understand how many of you actually attended the first webinar series. I will have the poll. Can you please vote in the screen? If you have joined the first event, can you please vote now? Or if you haven't done so, do that as well. Okay. Let me broadcast the results. So I can see that around 30% colleagues had joined first webinars and 70% were unable to join. So I would really encourage, for those of you who haven't joined the first webinar series, please do listen the first webinar series in recordings from the website. But I think to start with, Bob and myself will try our tone a little bit according to this the pool, so that we cover a little bit as we introduce new topic. Thank you. So can I have the slide in the screen, please? Great. So can I go to the next slide? So let me do that. Okay, so just to bring everyone up to the speed, I would like to re-emphasize here that our sector, when I say our sector, is water, sanitation and hygiene sector, including also other sector. When I say other sector, it does include health, education. So the way hygiene has been seen was always hygiene behavior change component has seen as always as an add-on activity rather than is one of the essential ingredient or foundation for any of our programming. So within WAS sector, within water, sanitation and hygiene sector, the sector was quite taps and toilet sector, more focused on infrastructure, the product placement rather than its use and sustainability, the way the sector has initiated, they started. Gradually, there was a recognition of bringing knowledge improvement alongside the infrastructure improvement within the sector by putting posters, pamphlet, using cognition model of behavior change, wasting lots of money on printing leaflets, caps and t-shirts, in addition to the infrastructure. And with that, there was a greater realization in the sector that just placement of the product and improving knowledge doesn't work in terms of sustaining behavior over time. So now we are adding, what we are saying, infrastructure and knowledge are fundamental, but not enough. So therefore, we are adding another brick into those foundations, which is behavior change brick. Within behavior change, we want to motivate people. We want to change the script in the people's head in order to change behavior. We also want to change behavioral settings. When I say behavioral settings, it's a physical, social, and biological settings that we want to change. We also want to encourage social norms for certain behaviors. That's what those behaviors, the routine behaviors, are actually translate in a habit. In order to do so, we want to reward people. We want to motivate people rather than sort of educating people. So this is the brick that we want to focus on. And this is the huge strategic shift, I think, within the sector. There is a greater recognition on focusing on behavior change. But how do we do that? How do we do that? We definitely need to have the process. In our first global webinar series, we have discussed about the different theoretical approach, different theory that actually inform lots of our programming work. One of those theories that we introduced was the behavior-centered design approach. And this behavior-centered design approach is not only offers a kind of theoretical underpinning on how to design intervention, but also offer how do we actually design, implement, evaluate your program in a strategic way, in a programmatic way. It does have 5 critical steps. We call them ABCDE steps, which is easy to remember. anyone can remember it, but we need to then translate into the practice when it comes to executing ABCDE process. So for today, we'll be covering A and B, which is A is all about how do we actually start understanding the unknown. The second, B, which is building our understanding through the formative research, more depth understanding on the formative research, we'll explain subsequently. And then the create is, once you understand what is known and unknown, then you need to design an intervention through a creative process. You need to go through a process rather than thinking and choosing one of your campaign idea and implementing it. Once you have the package, then you have to deliver, you have to implement through sustained routine mechanism using novel approach and evaluate it in such a way that you'll be able to demonstrate the effect of your intervention. So this is what the ABCDE is, but there are specific elements within this. So in order to better articulate ABCDE, in our last session, we have introduced a theory of sense linked to ABCDE. The way ABCDE happens, it's part of your assess and build, which is a formative research. We really need to understand the state of the world. Where are we? What are the prevalent diseases exist within the community where we want to operate our programming? Whether people are actually performing the behavior. Who is performing and what would motivate people to perform certain behavior, and in what environment they are performing the behavior, whether the environment acts as a barrier or as an opportunity for people to sustain their behavior over time. So we need to understand all of these either through assess or build formative research. Then only we can design an intervention through a multidisciplinary, using a multidisciplinary team, and design an intervention in such a way that when you implement it, that intervention should able to change the environment, should change the brain and body of the people, and then if we able to change the environment, if we able to motivate people, and that will ultimately help encouraging people to practice behavior and improve behavior, ultimately lead for sustained outcome, which is in this case might be health. But there are parameters through which we can sort of monitor the outcome and impact. We are not going to go on that front. So this is the theoretical theory of change for behavior-centered design, as I mentioned previously. So we're going to cover each of these steps in our webinar series. So today we are going to cover the A and B stage of ABCDE. So good. Okay. So so as part of the assess step, we are going to map out what is known and unknown. Next slide, please. So why this is important is because if you are a practitioner or if you are a researcher, if you want to start any programming, any behavior change programming or project, at the beginning, if you are a beginner, you have no idea how to start, where to start. Therefore, it is essential for us to conduct a step as part of your overall programming. So imagine yourself now, you have recently joined an organization and your manager actually tasks you to design a robust behavior change programming and execute it and evaluate it. How do you start? Where do you start? So imagine you are a practitioner now. So in this session, throughout, we are going to highlight some of these points as we move on. Next slide, please. Okay. So I'm going to use the same theory of change as part of the assess step. So next slide, please. There are click. Can we go? Yeah. So as part of the assess, so there are two critical elements. One is, before starting any new program, we need to understand what is known and unknown through a literature review. And then those literature review evidence need to verify through a framing workshop. So I'm going to go in detail in these steps. These steps are not new for any practitioners. As a traditional practitioners, any one of you might have, designed the project based on participatory design. You might have done subsectoral analysis. You might have done some review, national district data, and you might have designed some program targeting as part of your ritual programming. But here, another click, please. Here, by just performing literature review and framing workshop, we want to standardize the process and make it more efficient with provision of some checklist. so that you don't need to sort of, waste all of your timing just thinking through. You just need to go through the process. Next slide, please. So, next. So, within assess step, there are two critical sub-steps, which is one, doing a literature review. Second one is framing workshop. During the framing workshop, you are going to define your behavior, mapped out what is known and unknown, and you are also going to define your program scope. So you're going to set the objectives and some of the behavioral targets. Next step. So I'm going to explain each of these steps. So why do we need all of these? Is because we really want to understand what is known. So as part of your literature review, so first you need to determine what is known about the target behavior globally and locally. If you don't know all of these, what happens? You are going to start from the scratch. If you don't understand what works and what doesn't, you are going to repeat the same mistake. It is essential and vital for any behavior change programming. You should be understanding what exactly known in relation to behaviors globally and locally. And the compilation of this information should also paint the picture of the whole state of knowledge. It's not just one aspect, because it has to be comprehensive understanding. And then also, in order to do that, you can actually look for kind of a published literature, or you can also discuss with different people and gather lots of expert opinion. Next slide, please. And for this one to remember, is it like a metaphor? You are, let's say you are an artist, you want to design something. As part of the assess step, you start with a blank piece of paper, you just start painting it. You'll have very limited understanding based on the literature review and the framing workshop. Next slide, please. Good. Okay. So when we do our literature review, there are things need to be remembered. So the evidence will be always changing. The evidence that you have for, let's say, globally, only 19% people washed their hands this morning. So that means that evidence might change after 1 year. We need to definitely prioritize for the local data, and then you should be considering for both qualitative and quantitative data in order to sort of serve the purpose. And while doing the literature review, you can see there are lots of absenteeism in terms of there are lots of vacuum, lots of evidence gap. It doesn't mean that there is no evidence. It doesn't mean that the evidence doesn't exist. So because no one has done the effort to create that evidence. So we need to be mindful on that. And the quality of the evidence are often quantified and qualified with whether the evidence that we have is very weak or moderate evidence or strong evidence to make our argument much clear. Next slide, please. So as part of the literature review, so when it comes to kind of analyzing the information, so at the global level, you can actually review global published articles, journal articles, the global report, let's say including the joint monitoring report for WHO and UNICEF and the published article, and it will give you a very limited information. And if you are implementing a project in the national context, and then you can probably would like to also review the national data, national health management data, national reports, national policy guidelines, and then since you are planning to implement project at the local level, the behavior change programming, you should be definitely give more emphasis to collect local evidence, whether there is locally produced report, whether there is a partner report, whether there are learnings from the partners who already implement the program in any specific location. So you can actually build all of those information as part of your literature review. Next slide. Next slide, please. Okay. So when you do a literature review, and then when you start looking evidence at the global, national, and local level, you should be then start thinking, what exactly I'm going to look for? I'm going to focus, do I need to focus on a specific behavior so that I gather the sufficient information as we intend to sort of, design the intervention? So in WaterAid, and also I think within the sector, there is a growing recognition. That we should prioritize multiple behaviors. We have already justified in our last webinar series why we need to focus multiple behaviors, because there are critical pathways, multiple critical pathways through which pathogen can be transmitted into the new host, rather than just focusing on one behavior. So the active ingredients for multiple behaviors include hand washing with soap at critical times, fecal sludge management, which including child feces disposal, safe water management, does include household water treatment as well, food hygiene, specifically linking with the children food, thorough reheating, cleanliness of serving utensil, so on and so forth, menstrual hygiene management, and other context-specific behavior. And all of these behavior should be seen as a critical ingredients as we analyze the evidence. But when it comes to prioritization, you can prioritize based on the evidence and take 2 or 3 behaviors, when it comes to designing your intervention. But when you start doing a literature review and doing a formative research, you should be thinking these are the critical ingredients of the behavior, which are very much at the central of the critical pathways. Next slide, please. Good. So now let me, as part of your literature review, let's say, you like to understand where are we on different behavior. Let's start with the hand washing with soap. Can we click 3 times, please? Yeah. So when you start analyzing the global evidence, you probably would like to see the people currently practicing behavior, or the proportion of people, let's say the under 5 deaths due to diarrheal disease. Hand washing with soap is one of the critical behavior which helps reducing under 5 mortality, actually helps reducing almost 40% of the diarrheal disease. Diarrhea currently kills around 500,000 children. If people practice hand washing with soap, you can actually reduce the proportion of diarrhea by half, which is very significant. You can reduce the acute respiratory infection by 1/3, which is huge, right? Since you already know that hand washing with soap is very much critical on reducing all of these diseases, you probably would like to prioritize, and these evidence are already exist. You don't need to prove all of these. So this is the benefit of doing the literature review. Can you go to the next slide, please? And then you probably would like to see what are the critical points, what are the critical times for people washing their hands. So there are multiple critical points for people washing their hands, right? So the critical times for washing hands might be after defecation, after cleaning child bottom, before food preparation, before feeding, before eating. Similarly, these critical times are different at different locations. If you are working in a household setting, those are the critical times. But if you are working in a hospital setting, for instance, the critical times for hand washing in a hospital setting might be before and after touching patients, before and after exposure with any medical waste. So we need to understand what are the critical times that are already exist, the huge evidence that we have around all of these critical times as part of your the literature review. Next slide, please. And you can also probably like to see where are we in terms of the prevalence of this behavior. You can see in the slide this morning, only 19% people worldwide wash their hands after defecation. If you look at the statistics within healthcare center, only 38% health workers, around 60% health workers only wash their hands after touching patients in a healthcare settings. So that means in terms of compliance of the behavior, we are still lacking behind, and it compromise huge. It will have a devastating effect in terms of like health outcome. Next slide, please. So similar to other behavior, as part of your intervention, next slide, please. As part of your literature review, you probably would like to see the food hygiene. Where are we? Do we have enough evidence in terms of food hygiene? What are the behaviors that we are talking about within the food hygiene? Maybe food preparation and food handling, thorough cooking and reheating, food feeding, particularly washing hands before feeding and the cleaning, serving utensil before putting cooked or reheated food. Food storage, basically maintaining temperature, adequate temperature, which it has to be around below 6 degrees or above 60 degrees in order to maintain the temperature as well as to reduce the level of contamination. And then also, sometimes it's not easy to have the the refrigerator in place. So that means we properly need to store the food with a tight lid. So there are multiple behaviors you can prioritize within the food hygiene. So the whole idea is, do we have enough information? Which behavior within the food hygiene can actually be prioritized as we do a literature review? As we do the literature review, we'll have a greater idea which behavior has been prioritized and which of these critical behavior we should be prioritizing it as well. And next slide, please. And then you can see the food hygiene is one of the critical pathways. Next slide, please. Critical pathways, it can reduce diarrhea significantly, and we have the global evidence that almost 70% of those diarrheal diseases are due to pathogen transmitted through the food. But we still lack lots of evidence from low-income settings. We have lots of evidence from high-income settings, but very much lack of evidence from low-income settings in order to attribute the contribution made by food hygiene in terms of reducing diarrheal disease still. So yeah, then yeah, the other behavior is related to feces management, including child feces disposal. Of course, there are direct linked with our investment on sanitation to health impact. And this morning, when you wake up, I think you might have luxury to defecate in the toilet, but I think globally this morning, around 2.3 billion people defecated openly, and there are lots of benefits, both health and non-health related benefits if people defecate in any specific areas, that is, within the toilet, and managing those feces. And the health benefits are obvious, but non-health benefits also includes improved dignity, the protecting people from harassment, the reducing school absenteeism. There are lots of non-health benefits as well as we ensure safe and accessible sanitation facilities for people to enjoy. So these are already established evidence. Next slide, please. And then, of course, you can see as we started discussing about where the provision of toilet is actually help ensuring for people to use it, and you can see in the picture the pictures, the properly used toilet, and the people are not using even if the different type of toilet, and the way the people use a toilet in different location. If they don't understand the motives, if they don't know why they should be practicing the behavior, and of course they may not clean it, they may use unhygienically, and those toilet will become the epicenter in terms of transmitting disease. It's not only the provision of the services, as you can see, it's all about maintaining it, using it, and cleaning it as well. So those evidence need to collect through the through the literature review as we start designing the intervention. And those information are already available. You don't need to reinvent things. These are already available. You just need to be aware and document as you plan. Next slide, please. And then finally, as we discuss also the menstrual hygiene management, we do have lots of evidence that menstruation, the period is still the taboo issue, stigma, and there are still lack of information and awareness with different people, and access to menstrual products and the management facilities is still the challenge in many countries, as we can see. And there are still a lack of evidence in terms of whether MMSM has an impact. Of course, there are like anecdotal evidence that managing proper menstrual blood will have positive health impact, but we're still looking more robust evidence to quantify the magnitude of the problem. Can you click? So there are a few photos, as you can see. Here, the people often use wool cloths, and they hide those cloths under the other cloths, believing that if someone sees their blood, they will feel kind of they will be stigmatized. There are lots of rituals, traditional practices in association with menstrual hygiene management. All of these information need to be gathered as we plan designing the intervention, so that we are familiar what are the problem, what are the issues that we already know. And then if we don't know the information, then of course definitely we need to prioritize how we collect all of this information to better design through a next step, which is a formative research. So can we move on? So just wanted to, let's move on. So just wanted to sort of give you a little flavor. So what's the rationale of conducting a literature review? So let's move on. So those are like menstrual hygiene management related the facts and figure. So yeah, can you click once more? Yeah, okay, so the other one is, of course, as we discussed on the water treatment as well. So there are multiple options at the household level or at the institutional level to treat water. So we need to understand what are the existing mechanisms, what are the existing the options, and which one is actually feasible for people to adopt. So if we have growing evidence, if we have already defined evidence through the literature review, we again don't need to reinvent and test different menstrual method, because we can just build on and continue using the same evidence to design the intervention. So yeah, move on. Let's move on. So just to summarize this, yeah, can we go to the next slide? Yeah, just to summarize this. So in terms of like concluding whether we have enough evidence for all of these behavior, we can conclude that we have lots of evidence. We have strong evidence for hand washing, we have moderate evidence for sanitation, we have good evidence for water treatment, but we still have weak evidence for menstrual hygiene management, and moderate evidence for for sanitation, particularly on child fishery disposal when it comes to demonstrating health impact. But when it comes to social impact, we do, of course, because of the nature of the behavior, hand washing with soap and food hygiene has minimal social benefits, and of course there is no kind of not much attempt in the sector to sort of quantify whether practicing all of these behavior will have the social benefit, but they have the strong health benefits. Similarly, on the sanitation and household water treatment, particularly on the sanitation, there is a significant social benefit as compared to the health benefits. So all of these evidence are already quantified and somehow documented clearly, so that as we sort of design the intervention, we don't need to reinvent. All of these information are already exist. What we need to know is we need to understand, compile it, and sort of mindful of this evidence when we design the intervention. Next slide, please. So once you do the literature review, the next step within the assess step is the framing workshop. So framing workshop, can you go to the next slide? The framing workshop is just a one-day exercise. In the one-day exercise, you are going to discuss with your partners, your government stakeholders, and other allies who has been in the journey, water sanitation and hygiene, or other behavior change related journey in the past. You can invite them. You can conduct a one-day workshop using a specific checklist that I'm going to introduce subsequently. You don't need an external facilitator to commission this workshop. This is just a one-day exercise. And during the framing workshop, you can actually identify, and you can also verify evidence you have collected through your literature review as well. So this framing workshop can happen at the beginning of the project. If you have already implemented project, it can happen in between as well. So you can have a very light framing workshop with the stakeholders as well. And if you are focusing more than one behavior, you need to use a different checklist in order to perform the framing workshop. So now I'm going to introduce the checklist, how it works. Next slide, please. So as part of the behavior-centered design approach, we have developed a different checklist to facilitate this process. So when you are conducting a framing workshop, you don't need to sort of look what tool I'm going to use, what method I'm going to use. So as part of the, as you can see in the theory of change, there are lots of elements as we discussed: the environment, the brain, the body, and settings. So we came up with the specific questions that you are going to answer, or you are going to look for evidence as part of the framing workshop. So with these framing workshops are actually built in through the theory of change. Can you click here, because I have the theory of change. Yeah, can you make it full slide? Yeah, so using the theory of change, this checklist has been developed, and you don't need to even worry about what sort of question I'm going to ask during the framing workshop. You can actually ask the specialized question. So I'll bring few examples in my subsequent slide. So can you go to the next slide, please? So let's say as part of your assess step, you want to define the target behavior. So as part of your the framing workshop, you are going to actually use this, and then the questions has already been defined. Let's say if you want to sort of define your target behavior, you definitely would like to answer. So what specific action you are going to perform? Can you click? Yeah, if you look at what specific action you are going to perform, behavior is all about action, right? And then you need to know let's say your specific action might be increase hand washing with soap. That's the specific action. Who will do it? So you need to define your target audience. The primary caretaker of children under 5 or their family might be a target audience. Can you click again? And where will they do it? Where do they practice the behavior? The hand washing with soap. Maybe a hand washing facility near to the kitchen or in the toilet. And then finally, when they will do it, maybe can you click again? When they will do it after defecation or before eating. So if we know all of these information, you don't need more information in order to define your behavior through the formative research. So whole idea here, by using checklist, you define your specific behavior, what you want to target, and if you know already all of these information, you don't need to reinvent. You don't need to collect through the formative research. You are done, and then you collect additional information through the formative research. Next slide, please. As you can see in the subsequent slide, let's say now you also want to understand the physical, the biological, and social environment within the settings. Let's say one example, one specific question within the physical settings is, what is the physical setting look like? You have the information already. You are saying the houses are probably made up of brick, and houses are positioned in the compound. You have already said is probably. You don't have confidence whether all of these houses are made up of brick. So that means you want to understand more information. So you need more information. That means through your formative research, you are going to gather additional information. So this is how the assess step during the framing workshop, you're going to fill this form using the evidence from the literature review, discussing with your colleague in the room, and then fill this form. That will help you to understand what is already known. And then you can then position, as you fill the form, you will understand what exact information, what additional information you need. That way, you can actually frame your formative research question subsequently. So let's move on. Let's go to the next slide. I don't want to go in its details. It will take time. So can we move on? Yeah. So as you can see, can you click next? So as you can see in the checklist, so as you fill the form as part of your framing workshop, you can see there are lots of unknown as well. So one of the example is, let's say as part of your behavioral settings, you really wanted to understand the routine behavior of the people. What are the routine look like? How the people are behaving on their daily routine. So you don't know it. So therefore that information you might need to collect from the formative research. Can you click one? Similarly, you want to understand what are the touch points, what are the entry points, what are those touch points through which we're going to reach with their primary target audience to promote the intervention. If you don't know this, you need to collect this information through the formative research. You have asked these questions, neither you have gathered the information from the literature review, nor during the framing workshop. That means you need to collect this evidence from the formative research. So this assess step, using this checklist, will help you to understand what is known, and then give you a clear indication what is unknown, so that you can plan for the formative research. It's very easy. We can share through our things in the subsequent information. We'll share the checklist through alongside the webinar recording, so that you can use if you have planned to do so subsequently. Next slide, please. So within the assess step, you are also going to define your program scope. So basically, you are going to also define your aim, objectives, and some of the outcomes and the input indicators. So again, you are going to use the same theory of change, what impact you want to see, what behavior you want to change. You define your objective and scope accordingly. So you need to define some of the process indicators, the output indicators, outcome and impact indicators as you define your programming. So use the same theory of change in order to define those. Next slide, please. When you design the indicators, the indicator need to be very much smart. It has to be more specific, measurable, attainable, relevant, and time-bound. One example, let's say one of your objectives is to increase the observed hand washing facility with soap after defecation and before eating. So you want to increase the hand washing with soap after defecation and before eating by 50%. And then you also want to see whether improved behavior has an effect on reducing diarrhea. You can set up this as part of your assess step, and you design your program accordingly. But just here, I would like to emphasize that measuring health impact in a small project and in a small location is not always feasible. You need to have the control group. You need to have a robust the surveillance system, a robust mechanism to measure the health outcome. So therefore, within WaterAid, and I think there is a tendency within the WASH sector that we focus mostly on the outcome level indicators, as you can see as part of the objective as well, to have that impact. The rest of the link is already established, because if you improve the behavior, the rest of the link is already established. So as part of your assess step, you also define your aim and objectives using the theory of change. Next slide, please. And then you defined next please, to click. So you can also define the population that are at risk for public health as you define your objective as well. So mostly, as you can see, you want to reduce the under 5 children mortality, but they are not the one who is practicing the behavior. Who practice the behavior? Either the mother or the father or mother-in-law who is taking care of those children, right? And then the next, when you come to targeting population, and then you also like to see we influence mother behavior, we influence social leader behavior, mothers-in-law behavior, we influence father behavior. It might be the religious leader. If that's the case, then as part of your design, you should be including all of these target audience to reach with your intervention. So you need to identify, you need to define these as part of your assess step. If not clear, then need to collect the evidence through the formative research. Next slide, please. Next slide, please. I'm going to skip this. Yeah, the few click. So, so the key points, just would like to sort of, summarize the assess step. Why assess step is important is because we want to sort of, define the behavior. We want to focus on the specific behavior that has impact on health and well-being. And the assess step helps to sort of bring the evidence, whether the global or national statistics, local evidence together, putting evidence together to better design your program. And it also helps what is known and unknown in a structured way so that you better design your the formative research critically. Next, please. Yeah, so so just to summarize, in an assess step, it's very simple. You use the theory of change of BCD, and then you do two things. You do a literature review, you do a one-day framing workshop using a behavior-centered design checklist. This way you complete assess step. Now next step, you are going to go into the formative research to better understand, to gather more evidence around behavior change, to understand the motivational drivers, the determinants and all that the Bob is going to explain to you in his slide. Yeah, thank you. Over to you, Bob, now to explain about the formative research.
Great, thanks very much, Om. That was a really useful way of getting us to a position where we've done our lit review and our formative, our framing workshop, which has told us what it is we need to know to really address the intervention design questions properly. So we need to build on that knowledge, and to do that, we're suggesting that people engage in formative research, which is a kind of term of art for talking about ways of collecting information which is really based in the field. I mean, we're quite explicit about the need to get locally relevant information, and the only way you can really do that is by going to the places where the kinds of behavior that you're interested in are actually happening. So the formative research is something that you do prior to actually designing your intervention. We can use that BCD checklist, which people seem to be quite excited about, to help us determine exactly which behavioral determinants we need to find out more about. And there are various techniques that we can use to get this new information, which will then inform the design of the intervention. There are a range of tools that we're suggesting people can use, and there's a pretty significant difference between the kinds of things that we're talking about with formative research and what most people are really familiar with, these CAP surveys that have been around for a very long time, and which are much easier to conduct because essentially what you can do is talk about knowledge, attitudes, and practice in an interview with somebody in a room somewhere, very far from the context in which the behaviors are actually being practiced. So it's easy and cheap to do, but quite often the information you get is of low quality and doesn't really tell you the contextual stuff that really matters in terms of behavior change. So again, we're going to use the checklist, but this time we're going to be associating the various kinds of unknowns with particular methods for finding out about those unknowns. And again, you can find on the BCD website a formative research manual, which has a very long list of about 50 different techniques that you can use for collecting data on these different kinds of behavioral determinants. And they are quite different. I mean, some are environmental, some are psychological, and some are about what we call the behavior setting, which was covered in the first webinar. So just to run through a few of the possibilities, obviously our focus in behavior-centered design is on behavior. That's what you're trying to change. You really need to know as much as you can about the context in which it takes place. So when and where and why. To investigate that, and believe me, quite often people do not know much about the target behaviors and the constraints on which they're being performed. So we're really big on observation. And there are various kinds of observation. You can do structured observation, which is essentially someone spending a brief period as a researcher watching people from the target audience or population in context, engaging in the target behaviors. Participant observation is a more ethnographic or anthropological technique where essentially you go and live with people for a while and you observe the bigger context of daily life within which your target behaviors take place. Video observation we really love. Why? Because you can look at it again. I mean, behavior quite often happens very quickly. You can't really see everything. With a video record, you can go back and look. And here's just an example of how you do it. Quite often we try to get local people to do the videoing so that it's much less obtrusive and acceptable to the people that you're going to be following along with a video camera. We like to do it for hours so that people get used to it and they become more natural in their behaviors, and because that's really what you want is to see behavior as it's normally practiced. So here's an analysis. When you do have a lot of records of the target behaviors happening, you can figure out various contextual variables. And in this case, from Om's PhD, I think, we have a set of target behaviors where you know exactly how often they weren't happening. So these were opportunities for various food hygiene behaviors. Obviously, when people should have been doing something, but you can see in very high proportion of cases they weren't actually doing them. So this just makes sure that you're targeting the right kinds of things. That this is a real need for behavior change because nobody's doing these things currently. As mentioned, there are a lot of environmental factors important for wash behaviors in particular. You quite often need to have various kinds of stuff available or around at least. So you need to know, how is water supplied, for example? Is soap around? Are potties available? And to do this, again, you use different kinds of observational techniques, something like a transect walk, or particular interviews with the key people who might be supplying these various things that the people need to do the behaviors. And for example, a transect walk gives you the big picture. So what's available in the community? Transect walk is quite simple. You just pick a direction and walk through the community with a checklist in hand. To every time you see something, you make a note of it, and when it's not there, you make a note of that too. So you get a similar kind of result to what Om's results previously. You do spot checks in the household. Ask people to show you the soap if they got it in the house. If they don't, you make a note of it. There are also aspects of the biological environment which can be important to your target behaviors. Obviously, with WASH, you want to know how much contamination there is around, and you can do this through microbiological assessment, which again Om did to a significant degree, looking at food hygiene issues. So he measured at various points in the use of various foods and liquids, water and milk, to find out what the level of contamination was with respect to various points of risk, so storage and feeding and so on. And you can get very precise measures of the levels of contamination at these various points in which crucial foods or liquids are being stored or used in the household. But obviously, finding out what the environmental conditions are is not sufficient for really knowing what's going to be determining your behavior, because people are psychologically motivated or unmotivated to engage in target behaviors for various reasons. And we have a variety of tools for trying to get at motivation. We have a theoretical tool, which is the motivational pyramid, which was covered in the first seminar. So again, we urge you to go and hear about that. So it's a list of what we think are the various reasons that people would be engaging in various behaviors. Most of them are in terms of WASH, are obviously associated with disgust, the avoidance of pathogens in the environment. But there are other kinds of values that can be attached to the behaviors, and that's really one of the key behavior change tasks, is to make sure that you can give people new reasons for doing a behavior, and that means attaching new kinds of motivation to your target behaviors. And so there's a list of ones that you can investigate. And the methods that we've got for doing that are various, but one is that you basically show people storyboard for the target behavior. So if it's hand washing with soap, you show somebody like a mother who's just coming from defecation, and she passes by a water source and doesn't wash her hands, and you can then change the ending to the storyboard, either hand washing or no hand washing, and then showing various kinds of rewards that a person might get from doing that behavior. So you see the end of the storyboard, that the woman who has washed her hands with soap gets rewarded by her husband saying, "Oh, I love you very much for doing that." So that's the romantic love motive, and you get people's sense of whether that makes any sense to them. You know, was it ever possible that a husband would say something like that to you after you wash your hands? And you try out various endings, trying different kinds of things like status, social status. So someone important in the village also comes after seeing you do that and says, "Oh, I really admire you for doing that." You get the respondent's interest in that kind of a possibility. Does that make any sense to them? And that gives you a very specific kind of idea about which sorts of motives can be attached to your behavior and which you should target in your intervention. The superpowers game is another technique we've invented to investigate the role of motivation in life. This was actually a bit different. It talks about having a superpower related to each of the motives in the motive triangle. For example, to always be desired by women or men, depending on who you're talking to. That's a kind of a superpower associated with romantic love. Or that I'll always be prepared and ready for any situation. That's the create motive, so that you've got the environment set up such that you're always ready to deal with any kind of emergency. And you give people a certain amount of money that they can spend on acquiring each of these superpowers themselves. And this gives you a general sense of the relative importance of the different motives in a society, because this is not targeted at your target behavior. So here's some data, and you can see that although this is a qualitative kind of technique, we actually get quantitative results, and you find out that the most important motive in this particular population that we were looking at was nurture. So people thought it was really, really important in this society to be good parents, but they were also worried a lot about disease. So disgust came up second. People would wish to be able to avoid disease, in any kind of possibility. But you might be surprised to learn that play, which is the ability to acquire skills, basically through practicing them. That's what play is really about. Having skills is also very important to people in this population. So it wouldn't necessarily be the sorts of things that you might think, but this is a very good way of getting at the overall picture for motivation in a society. And then again, you can just tell very specific kinds of stories, again, using pictures. So these are obviously ways of using narrative, which is a very, very rich and powerful way of getting feedback from people, because everybody understands stories about these psychological factors which are less obvious. So I forget who, but one of the questions earlier in the chat was about body. What is body all about? And basically it's just about defining who it is you're really interested in, and thinking about aspects of the body which might be relevant, including disability. So we have a technique for getting people to respond to the challenges that they face as a function of their disability, called photo voice, which is basically giving somebody with a disability a camera to document their own life, and then interviewing them about why they took those particular pictures, and getting stories about the various ways in which they are constrained from engaging in a variety of wash behaviors. This is really powerful, and some of the stories will make you weep, but yeah, it's an excellent way of finding out what the real constraints are, and quite often they are environmental, obviously, which hopefully that you can address through an intervention. Then again, there's this behavior setting concept, which links together a number of factors, which we think are really powerful ways of getting at behavior change, because these things prove to be very significant behavioral determinants. So what what's the general stage in which the behavior is taking place. You need to know whether is hand washing with soap after defecation taking place near the toilet, or is it taking place near the house, or is it taking place somewhere in between. All that matters in terms of whether what facilities they're going to have available, and therefore how likely they are to practice the behavior. What role do they see themselves as playing? I mean, if you're seeing yourself as a nurturing mother, you're much more likely to wash your hands with soap, because you might then touch your child. But if you just see yourself as a free individual, then you wouldn't be thinking about your social responsibilities necessarily. So what role you're playing when you're washing your hands actually does matter. Script is the stored memory of what the prototypical sequence is for getting through a setting like washing your hands or cleaning up after defecation. And the props are the various kinds of physical objects that you need to use to get through that behavior. Obviously, soap and water being primary for hand washing. So these are techniques that we've got for addressing these various issues associated with being in a setting. So scripting, we actually have cards that take people through a whole day, and you can get more specific sets of cards to describe the very specific actions associated with the behaviors that you're actually interested in. But this is an excellent way of figuring out when and where and how particular behaviors get done on a regular basis, and whether people do consider your target behaviors to be part of their daily life. Attribute ranking is an interesting technique taken from psychology, where essentially you put a variety of different options in a ranked order based on some criterion. So this was a nutrition project we were working on, where we wanted to know how valued breast milk was compared to other kinds of foods, and so you could rank it on healthiness, for example, so healthy to unhealthy, and find out that breast milk is seen as being quite healthy, but so is formula, which came up right next to it. Not good. Behavior trials are really powerful, so maybe you can't do structured observation, you can't do video ethnography, but you can get people to perform the behavior right in front of you and then film it, in this case. So this was basically trying to get a woman with a small child to wash her hands before eating. And we found out that she was unwilling, by making her do this in front of us, we found out that she was unwilling to do it inside the house because that would get the floor wet. So she had to drag out a water source and a separate bucket for keeping the soap in, and then go through this very lengthy ritual where she nearly dropped the baby. And it was obvious that this was just something really difficult to get people to try to insert into their pre-eating habits. Teach the researchers, yet another technique for basically trying to figure out what it takes psychologically to do a behavior. So in this case, was the researcher, and he was trying to get people to explain to him all the steps involved in cooking a meal, for example. So you find out just what it is people think is involved. And obviously changing the stage can be a really significant way of getting a whole suite of things done. So Alm was trying to target 5 different target behaviors at the same time, and managed to do that by transforming the environment in which they all take place, from a place which was seen as rather degrading to one which is seen as rather pure. So it would be very difficult to practice a behavior which was dirty in such an environment. I'll mention touch points. Touch points is kind of a marketing term for understanding the context within which your intervention, people will come into contact or be exposed to your intervention. And there are a variety of techniques, again, for trying to get at this question, but one that we find really helpful is in the framing workshop, actually, to go through a touch point mapping exercise, which just puts your target individual at the center of a whole suite of social and physical kinds of events. So you can see that we're talking about going to a health service, or just talking to friends, or going shopping, or going to some religious service, et cetera, et cetera. There are all kinds of things that people do during a week or a day, and you map them all out and then ask the stakeholders and experts in the room which of these are most likely to be associated with your target behavior. A related technique is community mapping, where you get individuals to physically draw you a map of where they go, what they do at those various places, and you can then again aggregate over a number of informants to find out what sorts of things get done at different locations in the community. And obviously in this case we were interested in, this is a set of results from, again, an HIV study where we were interested where people might be having sex, but also where they might be doing related activities like shopping for condoms and so on. And you find out how often they do it. An important aspect of this entire process, so I've been talking about a lot of different techniques. So, which techniques do you use for how long? It's a function of sequential recycling, which is a process of rotating. Once you've been following a particular regime of data collection, you might actually have answers to some of the questions that you've been interested in. So after a daily debrief, you can determine, okay, we know enough about this particular behavior determinant now. We're going to drop that particular technique associated with learning about that and pick up a new question that's just turned up. So the investigation evolves as your understanding grows, basically. And this is just an example of a set of techniques that we use to address different kinds of questions. And you can see that the sample size is quite different. It's not like we were using the same techniques throughout our whole field seasons. So we use some for quite a long time, some for not so often. And it just depends until you get saturated with enough information about a particular issue to be able to drop it. Obviously, we're talking about researchers going into the field and getting mixed in with people's lives. So ethics is definitely a significant issue. For us as researchers, we always have to get the relevant ethics, both from our own institution and from locally representative institutions. So make sure you get that done prior to collecting any of the data. And please make sure that you feed back the results to the local communities, because they're obviously thirsty for knowledge and they want to know what the results were from you coming and hanging out with them. So just to summarize, obviously a lot of methods. I've again mentioned there are over 50 in the ABCDE formative research manual. Use methods hopefully to triangulate. So each of them tells you different things about a topic of interest, so they can illuminate one another. You can go back and summarize what you've learned on the BCD checklist just to make sure you've covered everything. And you can, again, share this kind of information back with the people that you've been studying. And let's make sure that we are clear about where we are. We have now asserted that we know enough about the behavioral determinants for our target behavior. What we haven't yet done, though, is figure out what we're going to do about it. That is, what our intervention is actually going to be. That is the next step, which is the create phase. So key issues, focus on behavior. Don't just listen so much to what people say, because people can say anything. Make sure you're looking at behavior in its context if you possibly can. This really does provide insight. You learn things this way that you wouldn't through any other kind of approach. And it feeds straight back into a theory of change. It tells you what you have to, it gives you very good clues anyway about what sort of intervention you will likely be engaging in to change the environment, to change the behavior, and then get to your ultimate impact. Ensure you pilot your methods. Quite often, and it's true also the people listening today, that a lot of people haven't done formative research before. It may sound like it's magic. To some degree it is, but anybody can do it if you're trained. And anybody actually going and observing behavior is going to learn something. You don't really have to be an expert to get something out of this process. It does require more than just interviews and focus group discussions, however. If you do it, and even if you don't spend that long doing it, I'm convinced you're still going to learn a lot just through observation and reflection. So just to finalize, again, we've covered assess and build today in the second series webinar, and the third series will cover the next couple of steps in our overall process. Create phase is the one which most people don't do at all. So hopefully people will be listening and joining us for that one. Thanks very much for listening.
Okay, thank you very much. Fantastic presentations. There's such a lot to digest. I know that I will want to watch it again, and it will be uploaded onto the SuSanA website. I've linked a couple of times the forum post, which will be storing all the information, including all these tools that have been mentioned, that there seems to be a lot of appetite for. Just quickly, Bob, do you want to go through the BCD website and what's available on there?
Sure. Mostly, I mean, there's a project page which talks about the various kinds of projects that we've used, engaged in using this process, and then there's probably what most people are interested in, a resource page which has the academic paper, which introduces the whole approach, a manual, which is more for practitioners, a guide, which is basically a more detailed theoretical background to the overall approach. We've got a simple infographic for, you know, a very easy summary of the whole approach. And as I was talking about before, these formative research protocols, so a whole suite of these things that anybody can use. It's very detailed about how to actually engage in these various data collection methods.
One that was asked earlier was Rosemary said she was looking forward to learning about how to change behavior in politically challenging environments. And there was another comment later on that as a person wishing that people in government would be watching this and talking about government's responsibility to provide safe environments for citizens. So I don't know if either of you do have any kind of reflections on how to engage with governments in these kind of areas.
Well, as I actually did respond briefly in the comment box, we are actively working on a couple of projects where government officials are our target audience, as it were, because they are the ones whose behavior has to change in order for the project to succeed. So this is both, you know, Swachh Bharat, which is this huge national sanitation campaign in India, as well as one that we're leading in Tanzania. And it is it's been eye-opening, of course, and you know, it's not a 5-minute response either to say what it is we've learned, but obviously in both of those cases, working from the top is crucial in terms of overall effectiveness. And Swachh Bharat in India was instigated by Modi. Basically the flagship program for his whole administration, and it's been hugely successful. You could say that political will is just crucial, and that is certainly the case in our experience. How do you motivate people to exert political will for your project becomes the central question, I think, in those sorts of contexts, and that's a different sort of behavior change issue, but it is certainly one which in many respects mirrors the one that people, and certainly us prior, have been looking at in terms of trying to motivate households. Bureaucrats are people too, right? And they have to have a reason for expending their political capital on your project, and you need to give them one. So some theory of change needs to be developed that results in a bureaucrat basically engaging in activities that promote your program.
Few additions from my side. As WaterAid, we also design institutional campaign, particularly targeting to policymakers and donors and funders to change their behavior, basically prioritizing behavior change as part of the policy context, allocating more resources, making sure that the national policies are conducive, and the government allocates more funding for behavior change component. So in order to do that, again, by just looking the whole ABCDE approach, we definitely need to understand what would motivate, let's say, policymakers within health sector to allocate more funding on behavior change. What would motivate Ministry of Education, for instance, to incorporate WAS behavior change component as part of their primary or secondary school curricula. So if we don't understand all of these and sort of, just telling the Ministry of Education, oh, include WAS curriculum as part of your primary curriculum, it's not going to work. So yeah, when it comes to design, we definitely need to understand the different drivers, conduct some sort of formative research to understand what would motivate different ministries, the institutions, the donors and partner, and design your institutional campaign in order to change their behavior. The second way of looking this, if you are designing an intervention targeting to change the behavior of the public, the primary target audience being the community people, then of course you need to think, how are you going to engage with the government since the inception phase of your program so that they own the process? When you demonstrate the model project, is government project, is government who is very much willing and the competent enough to sort of replicate that model as part of their ongoing programming. So engagement with the government, making sure that we use government routine mechanism to implement it. There is a tendency in the sector to sort of vertically implement behavior change programming. I think that's not the sustainable way we should be moving it. There are lots of issues people often think working with the government, the slow process, the accountability issues and all of these, but ultimately they have the power and they have the skill opportunity to implement it. I think for behavior change it is quite important. So even if we are designing and kind of community-based focus intervention, the government, the participation since the inception of this program, design, implementation, evaluation is very much critical, and making sure that we build the capacity of the government so that they feel ownership and they feel capacitated to implement the similar model in other settings. And the other way of doing this is basically designing an institutional campaign for their in order to change their behavior as well. Yes.
Yeah. Yep, I agree with that. It's basically just a different target audience, and recognizing that they are playing a professional role rather than just being an individual.
Okay, great, thank you. We've had a question here from Jennifer. Can we get some guidance on how to budget for the formative research process? We are more familiar with traditional methods and maybe the costs are similar.
Well, we did have another note saying that formative research is more expensive. I think it is, well, it can be more expensive than just engaging in CAP surveys, but it doesn't have to be. Basically, it can be one person going to the field and collecting as much information as they can. It's question is how long is a piece of string, and the question maybe more is what proportion of your budget should you be spending on formative research, and we kind of suggest that 10% is a reasonable kind of figure, because there's not a lot of point in designing an intervention that isn't appropriate. And you're going to waste all of your money on implementation and not having any kind of impact if you've basically not understood the context in which your intervention is going to be implemented. So the ultimate cost is that you waste all of your money if you don't do it.
Yeah, and then in addition, there is a tendency, I think there is a misconception within the communities that the formative research has to be representative. Is a misconception. The way we laid out the formative research, the richness of the information should determine the sample size, is because what we are looking for is the strength of the information, the reach of the information, rather than quantifying the magnitude of the problem. That can be done always through baseline and other form of evaluation process. So the formative research, it has to be very simple. It has to be it should not be resource intensive, otherwise it will be seen as a lengthy process. And as a practitioner, we don't have much timing to waste a lot of, lots of months to sort of, conduct the formative research, because our resources are limited, our time are limited. If we are looking for like 2 years project, and ideally we're looking for 2 months, maximum 2 months of formative research, and all of these will actually determine your cost. And as Bob was saying, so you should start with few households, few key information interviews, few tools as we discussed, and then see whether you are starting collecting the repeated information. You will stop there. If you are saturating your information, then you stop there and then conclude your formative research. So as Bob was saying, 10%, I think depends on the context, but I think our experience is also the same. You should not waste lots of money on formative research, and should not waste lots of timing. But this is very much critical step. Otherwise, if you design the intervention based on what we think as an expert, it's not going to work either. So it's a kind of compromise based on the size of the project as well.
Yeah. There's another excellent question from Aaron. Shall I?
Yeah, go ahead.
Try to pick up on that? Yeah. Obviously, there are a lot of behavioral determinants, right? And a really important issue is which ones are most important to tackle, both in terms of research, in formative research, and in terms of when it comes to designing your intervention, which kinds of routes towards behavior change can you take? And basically, our method is essentially to do expert consensus on these kinds of issues, because it's really impossible to know which are the most important determinants of a behavior. In terms of an academic researcher, we're never going to know, and it quite often will be context specific anyway. So what we do is then poll people, often in the room, for during a framing workshop or in a creative workshop, which we'll be talking about later, basically to get a sense of where we should be going when budget is limited, what things to prioritize, and it's just what people think are important and what can be changed. Do you have any suggestions, Om?
I do agree with your points, Bob. I think I just would like to pick another question from Aaron. So there are many tools and formative research. So how are you going to use it? So that's why we wanted to do the assess step using the BCD checklist is to minimize and to focus. So once you fill up the checklist from your literature review, from the framing workshop, and then you will see the gap where the information needs to be collected. Let's say the information are, let's say if you need more information on what would motivate people, then you should be doing a motivational mapping rather than doing a household observation to understand the practice of the people. If you want to understand what are the touch points, and you should be using only the touch point mapping exercise rather than other method. So the whole idea is to use it by just using the checklist. It will minimize the length and the types of tool we are going to use it, and then it has to be more specific because you are gathering any specific information. So what should not be missed, I think based on our experience in WaterAid, what you should not be missed is you definitely need to sort of somehow understand the current level of practices. You need to understand the determinants. You need to understand the motivational drivers, the barriers, and the touch points. These are very much basic, essential ingredients when you design the intervention. Otherwise, your intervention is you are not able to design your intervention. So these are basic minimum, and then you can add on more multiple methods to quantify, to sort of triangulate your findings, because you want to be more confident as well. And then you also want to sort of use multiple tools in order to sort of gather the evidence that are more robust for you to design the intervention. So you can be more selective based on the checklist. If you fill up the checklist, and then you will have a better idea. And as I said in the previous discussion, so we are currently defining, revising the tools, and those tools will be available subsequently a few months down the line. So you can actually link with the specific information you need with the specific tools that you should be using it. So we are working on that. Bear with us for few additional ones as well.
2 more great questions just come up.
Great, thank you. Yeah, fantastic questions. Thank you so much for asking all of them. We've reached the end of the scheduled time. So just quickly, I would like to draw your attention once again to this forum post, which is the one place we'll be posting all of the recordings, the materials, links to everything, and also a summary of the questions that have happened throughout the chat box and those that we have not yet answered. And I will be directing and Robert to the forum posts to maybe answer any that got away. And thank you so much for attending and for the great discussion. Thank you again, Bob and for your fantastic presentations.
Pleasure.
Yeah, brilliant. Thank you. Hope to see you for the third webinar in the series.
Thanks, everybody.
Thank you so much, everyone. See you next time. Thank you.
Bye.